Well, it's hard to believe it's almost the 4th of July. The year is nearly half over.
What?
Yeah.
Where's the time go? Well, that means we're getting closer to fall and the cold and flu season. And what about COVID? UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us as he does every Tuesday.
Welcome.
Hi there.
Good to see you
guys. Yep.
So are we expecting boosters this fall?
I think so. I think what we'll see, if they can make them in time, are these hybrid boosters that not only have the formulation that we're used to that kind of covers original COVID, but specific strains against these Omicron variants, maybe BA4, BA5, which are likely to be the more dominant strains come this fall. So that would be good news. That could pull us back to people who get boosted not even having symptoms of COVID after they get those booster shots.
So it seems like boosters are at least in the immediate future then.
Yeah, I think what we'll likely see is a COVID booster, if you want to call it that, along with flu boosters, our annual flu shot. A couple years from now, we won't remember a day and a time where we didn't get our COVID shot every fall, just like we get our flu shot.
I think the FDA is going to make this decision by the end of this month on what they're going to do this fall. So.
Yep, I agree.
So how are the hospitalization rates right now? Because we see a lot of COVID out there.
We see a lot of COVID, but what kind of came to fruition, we talked about this kind of with these later Omicron surges, is a combination of folks who are vaccinated and boosted and individuals who've likely recently had COVID, whether they knew it or not, built in some immunity that even though cases went up with these latter Omicron variants, hospitalizations didn't go up at the same rate, and certainly critical care admissions didn't go up much at all over baseline. Not to say hospitals aren't busy, they're very full of other sick patients, but it's not the COVID patients that are putting a lot of stress on hospitals right now.
Well, the one study looked at 20 million lives saved due to vaccines worldwide. So is that, what can we learn from that then?
Get a vaccine.
Yeah, get a vaccine. I think, it's hard to even comprehend that number. But, if we remember back to COVID, especially the earlier days, I mean, a lot of people are getting COVID, and a pretty high percentage as far as like a disease goes, we're dying of it. And now to live in a day and age where, yeah, we get sick, but we're not going to the hospital, we're not ending up in the ICU, we're not dying, boy, that's a pretty big change.
Yeah. UW Health now has the vaccine for under 5-year-olds. Seen a big interest in this or not?
So our vaccination for those kids started today. Scheduling opened up yesterday, so we're seeing some interest, but it's early. I think the one thing that's good for folks to know is that those kids under 3 need an order or a prescription to get that vaccine.
Do they?
So just showing up at a pharmacy, sometimes that doesn't work out. Best to potentially call your pediatrician's office. Usually the health system has a really easy protocol in place where they can send that order over. Makes it a little bit easier once you arrive at the pharmacy.
Well, and switching gears, with your other hat being in the ER, 4th of July is approaching. Sometimes people like to celebrate a little too much and they get hurt. Do you see a spike in injuries this time of year?
We do. In the emergency department, we kind of like take bets on what kind of firework injuries that we're going to see. So, things that, seem innocent enough can be dangerous, particularly those sparklers, those metal ones. They get really, really hot. Sometimes kids freak out a little bit when those sparks come flying. They might drop it on their foot and they'll get a burn from that. The other thing, these aerial things, whether they're artillery shells or things like that, they're expensive. So when they don't go off, folks are like, well, I'm going to figure out how to light this thing. And just about every year we'll see someone who catches one in the chest or something like that. Really bad injury. And then the other thing is, almost every firework injury starts with a saying of like, hey, hold my beer for a second. So just lay off on the alcohol a little bit
last words
if you're going to light fireworks.
And I guess the good news here is there's a shortage of fireworks and they're expensive.
Yeah, I mean, that might decrease, how many injuries we see. That'll be interesting. We really haven't had that scenario in the recent past.
I see that video, the dummy blowing up.
Right.
Every year. Nothing that bad.
Well, sometimes you don't want to be that guy, but it's just really important that you're safe with fireworks. Like, don't mess around. They can be really dangerous.
All right. Good advice as usual. Jeff, good to see you again.
Thank you.
See you next week.